from India. Let's move international. We have Ms. Parvana Valiyeva from Azerbaijan, who's an activist and public health expert and executive director of Support to Health, which is a non-profit organization registered in Azerbaijan. And she has been a board member of the TB Europe Coalition since March 2021, head of International and Public Relations Division, Ministry for Culture of the Republic of Azerbaijan. She's with us, and we would like her to speak to us about her experiences with community involvement in the fight against TB in her country. Thank you. Welcome, Parvana. I hand the mic over to you.
Thank you, Madam Barat. It's my pleasure to join today to our Indian colleagues and to listen their efforts to fight against TB in their countries. I think your community is really powerful in India in response to TB and implementing digital health solutions that I saw. One impact and the other things. Now I would like to share our contributions in our country, how civil society organizations and communities fight against TB in our country, in Azerbaijan. Let me share my screen. Can you see my screen?
Yes.
Okay. It's my pleasure to share with you Azerbaijan civil society organizations' efforts in TB response in Azerbaijan. As Support to Health NGO, we are implementing TB treatment follow-up and strengthening TB treatment adherence project in prison, in penitentiary facilities. The project first started in 2009. According to the tripartite agreement among ICRC, Minister of Health and Minister of Justice. After the project ended in ICRC, they hand over this project to our organization, Support to Health. As you see the logo, Saglamlığa Khidmat Public Union, it's our organization. Since 2011, we carry out follow-up of ex-prisoners TB treatment who released from prison with incomplete treatment. Every year in our country, 18% of TB patients released from prison. Their judgment time end, but their TB treatment continue. So that's why we should collaborate with prison sector in order to ensure provision of TB treatment in civil and TB facilities for these patients as well. Before civil society, our organization's intervention, majority of prisoners, when released, were lost to follow-up. They didn't continue treatment in civilian sector. Before 2009, there was no any TB treatment in civilian sector as well. No TB drugs were available. That's why in 28, in the year of 28, Azerbaijan was the highest MDR TB rate in the world. And that's why ICRC started a project, procured drugs for civilian sector as well. Then in 2009, we started project according to tripartite memorandum among Minister of Health, Minister of Justice and ICRC. if the drugs, TB drugs, were not available in civilian sector, that's why released patients also didn't continue their treatment and continued to spread their disease to other peoples. That's why we had highest rate for MDR TB. And if you can see the chart, we demonstrate here that it is blue is released TB patients, and yellow is the patients who continue their treatment. It is quite high after 2011 regarding our civil society organizations' involvement. And non-adherence to TB treatment amongst ex-prisoners and prison population is common because there are some factors, for example, lack of misinformation about the disease, stigma, discrimination. They start their treatment. After a while, they feel better and avoid to take their antibiotics. That's why it developed MDR TB. Poor management of side effects of TB drugs in civilian sector, because auxiliary drugs are provided in prison, but civilian TB facilities do not provide these drugs. That's why the patients who are not able to bear side effects avoid to continue their TB treatment. Social factors can be they don't have any income after release. They start again criminalism, and maybe they can have poor communication with healthcare facility, or we also face some challenges regarding stigma that people who release from prison do not trust to our doctors and continue to seek care in different countries, mostly in Georgia, in Russia, in Turkey. They migrate because they think that they can be treated better in another country. So these are all main reasons that led to non-adherence among prison population. We cover all the country. This is Azerbaijan map. And here you can see MDR and drug sensitive TB patients with items that we cover these regions within our project. And our project are containing two phases, before release phase and after release phase. Before release of prisoner TB patients, our consultant in penitentiary sector meet with these patients who are going to release in 1 or 2 months, and he conduct educational session with them, collect their medical and contact information. They also explain them how to get registered in civilian TB facility after release, who will help them. Our consultant share our organization's contact information with them, and we also collect the contact information of the relatives of prisoners in order to get contacted after their release, because they don't have any phone on them. That's why right after their release, we contact with their relatives to find these people. In many cases, they by own find us because as we educate them during prison about importance of continuation of TB treatment and its consequences when they don't they refuse continue their treatment, we all explain them. That's why they a bit frightened about the consequences, and after right after their release, they contact with them, our coordinator in civilian sector, ask questions, where to go, where to approach, to take their to bring their documents, medical things, and etc. And after release, until they complete their treatment, our organization every month visit them in their regions where they live. They are registered the DOT points, healthcare points that is closest to their house, and they continue their treatment there. Our organization deliver TB drugs monthly to DOT point or at home, and we collect sputum specimens from these patients and deliver it to the laboratory of Minister of Justice. All these results, treatment results, are going to the database of Minister of Justice. We also conduct some kind of psychological conversation with family and the patient, and mainly patient's family members ask some questions regarding the treatment and etc. We reply, we answer, and clarify their questions to family members because they concern about their family members and their closest ones. And we also support ex-prisoners and their families socially. We support to get monthly disability allowance from the Ministry of Labor and Social Protection. If they need national identity card, as they have difficulties, challenges to get it, we can also help them. Also, if they need to stay somewhere, if they don't have any home to live, we find shelter for these ex-prisoner TB patients during their treatment. In some cases, we repaired their houses and provide some household items with the help of some sponsors, donors of our organization. Since 2011 until end of 2023, 914 ex-prisoner TB patients benefited from our project. Here you can see MDR and DR-TB patients. And yes, our organization's contribution. This red line is showing a loss to follow-up cases. It was very high before 2011. Many cases were lost to follow-up, but now we have only 1 or 0 lost to follow-up cases per year, and many of them are cured. This project, in collaboration with Minister of Health and Minister of Justice, are held by our organization, and we several times prepared, develop abstracts to submit to WHO journals, compendiums, Harvard journals, and etc. It is as a best practice. And in Azerbaijan, we have a WHO collaborating center in prison control and management. all over the world, experts, doctors are coming to Azerbaijan, Baku, to learn Azerbaijan experience in the fight against TB in prison system. I can say just some of them in order not to keep more time. In lessons learned, non-adherence to TB treatment is a major problem in TB response in our country. Incomplete and interrupted treatment often lead to relapse cases, continued transmission, and development of drug resistance. While we have good practice, good experience in treatment adherence in prison, we don't have such kind of experience in civilian sector for civilian sector TB patients. So that's why adherence to TB treatment among ordinary people is less than ex-prisoner populations. And we, as civil society organization, also can implement community-led TB screening with portable X-ray device. It was the first time in 2021 during COVID-19 pandemic time that we bring up this portable X-ray that is equipped with artificial intelligence, and we conducted mass screenings among risk groups, refugees, IDPs, migrants, poor people, people living in remote areas, in mountains. We carry with our 10 kilogram portable X-ray device, and to bring the services, TB services, closer to their community of key populations. You can see some, and we also deliver care at home to the TB patients who are not able to come to a health care facility. As we see, one impact solution, community-led monitoring in India, we already listened your experience. Azerbaijan also implement community-led monitoring through One Impact Azerbaijan mobile application, and we will continue our efforts to accelerate, to improve usability and accessibility of One Impact tool within challenge facility round 12. And I would like to share our NGO's trust philosophy that we created this for our staff, our NGO. We should teach, educate, and counsel the patients, because it is the right to information for TB patients. We should respect the patient's rights, dignity, and they should be respected and trusted. It is understand. We should understand patients' problems. That is people-centered healthcare of TB. And as we speak in patients' language, we listen carefully to their problems, and we share their deep concerns regarding their treatment, regarding their disease. And the last one is a truth. Tell truth the patient in order to remove TB stigma, TB misbeliefs. Thank you so much for your attention, and I would like to thank to all speakers and moderators of this conference in order to organize such kind of conference during World TB Day.
Thank you, Parvana, for a lovely presentation. It was very informative What you do in your country is great. And you are also implementing CLM, you know? Do you implement CLM?
Yes, yes, we
Yeah.
are implementing CLM through One Impact application.
In India, we are launching it. We are the first one to start with the CLM here.
Great, good luck. Since
Thank
2000,
you. Yeah, please continue.
Since 2019, we started implementation of One Impact application, and we adopted it through Stop TB Partnerships project with their technologies, with the help of the technologies. It is already 5 years that we continue with
5
this application, and now we will improve its usability to level up our application in order to get make it more accessible for our patients.
Thank
Okay.
you.
Thank you for your time.
Thank you,
Bharati.
Parvana, for that really